person becomes unconscious, every second is vital. The brain begins to die due to the lack of oxygen, and it becomes permanently damaged. Research shows that heart disease is the leading cause of death in the United States. About 380,000 Americans die each year from heart disease, so these people are at a higher risk of having a heart attack. If this were to happen, would you know what to do? Knowing how to administer CPR or cardiopulmonary resuscitation can save a life. Please note that for this speech demonstration that all necessary personal protective equipment may not be used, such as gloves or a mouthpiece. The first thing you need to do is you need to check the scene for safety. When you arrive upon the person, you need to check and see if they're responsive, but you don't need to do this longer than 5 to 10 seconds. Next, you need to call 911. After you call for help, the first thing you need to do is open the airway, and you would do this by head tilt, chin lift. So you push up on the chin and pull back on the head. Next, you need to check to see if the person is breathing. You're going to do this by listening to their mouth and looking at their chest and see if they're gasping for air. Next, what you're going to do is you're going to give compressions. And you're going to give 30 chest compressions, and you're going to need to push in at least 2 inches at about 100 times per minute. And you do this by locking your fingers in your fist and your elbows. And you need to push 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And like I said, you need to do this 30 times. Next is airway. Once again, you're going to do the chin lift, head tilt technique. And when you do this, you're also going to pinch their nostril and seal their mouth. You would administer 2 breaths until you see the chest rise. You would do 5 sets of 30 compressions and 2 breaths before reevaluating for a pulse and breathing. Now, after reassessing if the patient has had a pulse, you may have to assist in rescue breathing. You would do the following. You would give 2 rescue breaths, you would blow in for 1 second. You would repeat these steps until help arrives. So, like I said, when a person becomes unconscious, every second that passes is life-threatening. Knowing what things to do and what steps to take can save a life. Taking a CPR class only takes about 4 hours, and knowing how to perform this technique could make a lifetime of a difference. To find out more information about CPR, you can go to www.redcross.org for training and certification. You can find out where local classes are held. Thank you.